An unprecedented surge in COVID cases has left several hospitals in Delhi gasping for oxygen, and in a desperate move today, after telling the High Court that the centre was not complying with the allocation of oxygen to the state, the Delhi Chief Minister has now written to all other Chief Ministers asking if they have any oxygen to spare. On Friday, the national capital logged 348 deaths linked to COVID, the highest in a day so far, leaving its crematoriums, its burial sites all overburdened, making them sites for traumatic scenes as family members have to wait for hours hoping for a spot, a square piece of land to cremate their loved ones.
Nigambodh Ghat, one of the largest crematoriums in the country, is struggling to handle the high number of bodies for funerals. The cremation ground witnessed 900 COVID funerals in the last 22 days, around 2 funerals every hour. Family members here have to wait for hours to perform the last rites of their loved ones.
अब इन्होंने फिर कल 4 बजे इन्होंने बॉडी का बोला, हमें 7 बजे बॉडी मिलेगी, और अब 7 बजे से हम वहाँ खड़े हुए हैं, अभी तक अब बॉडी आई है हमारी। एक एम्बुलेंस में भाई साहब 4-4, 5-5 बॉडी आ रही है।
So that's the situation here at the Nigambodh Ghat, where this attendant from the LNJP hospital with 2 ambulances filled with bodies have arrived here at the Nigambodh Ghat.
Ambulance drivers and attendants have lost count of the number of bodies they have ferried from hospitals to crematoriums.
अकेला इंसान क्या करेगा? इस बात का जवाब दीजिए। कितना बॉडी आप हैंडल कर रहे हैं अभी? ये मैं बता नहीं सकता।
Families also complain of steep prices of flowers, incense sticks and milk sold outside the ghat, which are used during the last rites.
हम पहले से बहुत ज़्यादा परेशान हैं। हॉस्पिटलों के अंदर बहुत ज़्यादा लूट मचा रखी है। 2 दिन का 3 दिन का हमारा 2.5 लाख रुपए का बिल बना दिया उन्होंने। वहाँ से एम्बुलेंस से जमुना पार से निगमबोध घाट लेके आए हैं, उसके अंदर 10,000 रुपये एम्बुलेंस वाले ने ले लिए।
The numbers keep increasing, setting a new record every day. Almost 14,000 people have succumbed to the infection in the national capital. From hospitals to crematorium grounds, the capital city is struggling with the rapid spread of the coronavirus. With camera person Sushil Rati and Pooja Arya, this is Arvind Gunasekar for NDTV.
And there were panicked scenes at various hospitals in the national capital as relatives were told to take their sick wards home and make their own arrangements for oxygen as hospitals were running out of the life-saving gas. 25 patients being treated for serious coronavirus symptoms admitted at the Jaipur Golden Hospital died on Saturday amidst a shortage of medical oxygen.
A 43-year-old Kamal is inconsolable. His brother and sister-in-law were admitted to Jaipur Golden Hospital in Delhi. This morning, he got a call from the hospital saying both his relatives had died due to lack of oxygen. For the last 3 hours, he's been waiting here outside the hospital for their bodies. 22-year-old Gaurav's mother and father both died at this hospital, allegedly due to lack of oxygen.
मोम की तो वही ऑक्सीजन फ्लैचुलेट बंद हो गया था एकदम अचानक। अम्बेडकर हॉस्पिटल पता नहीं क्या हुआ, XY रीजन दे रहे हैं जो डॉक्टर, वहीं डेथ हो गई ऑन द स्पॉट। फादर का कॉल आया रात को 1 बजे कि एक बार आ जाओ, आपके फादर देख लो। आया हूँ तो यहाँ बता रहे कि डेथ हो गई आपके फादर की। रात को ही फोन पे कह दिया था उन्होंने डेथ हो गई।
You can see the police deployment here. Paramilitary forces have been deployed outside the hospital to deal with any law and order situation. But as of now, things seem to be very critical. As of now, several patients, more than 200 patients are inside, and hospital administration is saying that they still don't have enough oxygen supply to support these patients.
Just a few kilometers away at Saroj Hospital, 140 COVID patients are on oxygen support. But the hospital says they have not received oxygen supply for the last 2 days. They have now put up a notice saying they are discharging patients as oxygen is running out.
हमने ये बोला है कि इस समय हमारे पास ऑक्सीजन खत्म होती जा रही है, हम लोग बैकअप पे हैं सिलेंडर से, और जो 1-1.5 घंटे के अंदर खत्म हो जाएगी। सब पेशेंट्स को ये अलर्ट किया गया है कि काइंडली कृपया अपना अरेंजमेंट अपने आप बनाएं, अगर हो सकता है तो वेरी गुड, नहीं तो हम सब लोग मिलके जो भी कंसिक्वेंसेस होंगे फेस करेंगे.
There are around 20 hospitals in Delhi where it's an hourly struggle to get oxygen for their patients. Delhi's Saroj Super Speciality Hospital, where at 10 o'clock in the morning, the administration requested the patients to be discharged as the hospital was out of oxygen.
My mother is very critical in the ICU. वो कह रहे oxygen नहीं है, and my mother is on a ventilator situation which is high oxygen power. Sir, हम लगे पड़े हैं हर जगह पे, कहीं cylinders नहीं मिल रहे हैं. We are not getting full cylinders, so we are trying to find empty cylinders because we can still get those filled.
At Delhi's Batra Hospital, the situation equally grim, with hapless doctors resorting to sending out SOS messages on social media, pleading for help, saying they were panicked and exhausted trying to keep patients from breathing their last.
I've been waiting at the Delhi Secretariat to meet the Special Secretary Health for the past 2 hours to arrange oxygen. In the meantime, the oxygen at our hospital has finished completely at about 2 p.m. and we really see no hope because there is no oxygen supply in the pipeline as well. We really wish and pray for our patients and for something to be done in this difficult hour. Kindly help.
Meanwhile, as per Centre's allocation order dated 18th of April, Inox, one of the largest medical oxygen suppliers to Delhi, was to supply 105 metric tons per day to Delhi hospitals. On Friday, they have supplied only 83 metric tons. The Delhi High Court today lashed out as it heard a hospital's petition over shortage of oxygen for seriously ill COVID patients, saying anyone obstructing the supply of oxygen will not be spared. The Delhi government told the court that the system will collapse if the capital doesn't get 480 metric tons of oxygen.
As the number of COVID-19 cases are on a rise, hospitals continue to be overstretched with more work. And as the patients are running around for hospital beds, now hospitals are running around for oxygen. And no permanent solution by the government or the authorities in sight. With camera person AJ Joseph and colleague Arvind Gunasekar, I'm Akshay Dongre for NDTV.
And in the midst of all this, there's one state that's standing out. One state with a surplus of oxygen amidst a mounting COVID crisis. And no points for guessing, that state is Kerala. Kerala has actually increased its oxygen availability by 58% over the last 1 year. So how is India's only oxygen surplus state managing the crisis, and why can't their model be followed by other states? Sneha Mary Koshi reports.
Oxygen refilling units such as this one in Kerala is one of the reasons the state, despite a high number of cases, is an oxygen surplus state, unlike many states, especially in the north. Since the start of the pandemic, Kerala almost doubled the air separation units, revamping 6 of them, and today all 11 are running at full capacity, according to the Deputy Chief Controller of Explosives, Dr. Venugopal.
Now at present we are able to supply everything, and now in this week Kerala maybe under the coordination of PESO everywhere they are reaching. Each day as we see the numbers going on, our heartbeat is also going on because we are expecting polls, and we are, it is sad for us to tell that no, we cannot supply.
The Inox oxygen facility, which is the biggest in the state, used to provide almost 40% of its 149 metric tons capacity to industries, say till 2020. And now it is fully delivering only to hospitals. Here at Thiruvananthapuram Medical College, the storage capacity has almost been doubled from 20 kiloliters of liquid medical oxygen to 40 kiloliters of liquid medical oxygen.
So what's the Kerala model? After the first COVID wave, the state focused on augmenting capacity, rationalizing use, preparing for the crisis that a second wave could bring. Key government hospitals had additional storage capacities installed, while the state increased its oxygen availability by 58% within 1 year.
Even before October, when we reached the peak, we had this issue. We knew that our oxygen capacity would be low. So what we did was that the government spent a lot of investment on oxygen plants. You know, the majority of the ICU beds are actually in medical colleges. If you take 10 medical colleges, all the 10 medical colleges are now having at least 2 liquid oxygen plants like this.
Oxygen production in Kerala at nearly 220 metric tons is more than double the state's own demand. So it has been able to send oxygen to Tamil Nadu, Karnataka and even Goa through the various non-government suppliers.
നിലവിലെ സാഹചര്യത്തിൽ നമുക്കാവശ്യമായ ഓക്സിജന്റെ അളവ് 74.25 മെട്രിക് ടൺ ആണെങ്കിലും 219.22 മെട്രിക് ടൺ കേരളത്തിൽ ഉൽപ്പാദിപ്പിക്കുന്നുണ്ട്.
Andhra Pradesh is the other southern state that is now delivering much needed oxygen to Maharashtra from the steel plant at Vizag on the new Oxygen Express train. With Uma Sudhir in Hyderabad, Sneha Koshi in Thiruvananthapuram for NDTV.
All right, but there is some good news in all of this, and it is that the numbers in Maharashtra seem to be improving. Mumbai has reported 5,888 new COVID cases on Saturday evening. This is a significant drop from the 7,221 that it reported on Friday. The daily positivity rate has now dropped to below 15%. This from the 18% recorded last week. This is significant because this is now a 3-week low in daily cases. Remember, Maharashtra has been under strict restrictions since the 14th of April. And the third sero survey results for Mumbai are out. 36.30% seropositivity found in 10,197 blood samples. The seropositivity in slum areas, the report says the results say are decreasing, while the seropositivity in non-slum areas increasing, and the vaccinations should be accelerated in order to limit the spread of COVID. Sohit Mishra now joins us. So it's certainly a little spark of a hope tonight as we see the new numbers coming in for Mumbai in Maharashtra. What are we attributing this to? Because we know, if you look at the studies, you look at the data that's out, the positivity rate falling since the 14th of April when Maharashtra has been under strict restrictions.
That's right. This is a 3-week low in daily cases. If we talk about Mumbai, 888 cases were recorded. So this is good news that we can say, as well as we can also. But what we need to say is that the number of deaths linked to the virus has remained roughly the same over the past 3 days. That is 71 was on Saturday, 72 on Friday, and 75 on Thursday. So basically, one good news is that the number of cases that is coming forward is less. Now remember that there have been several restrictions that has been put by the Maharashtra government as well as the BMC, if we talk about Mumbai specifically. Like from 22nd of April, a new guideline was brought into place in which people weren't allowed to travel inter-district, and if they belong to only say services which require essential services only, then they were allowed to travel either in the railway station or in the buses. So these were the few steps that has been taken forward. However, as I said, this is the lowest in the last 3 weeks, but it would be very important to see if Mumbai maintains similar cases in the coming days, or the number of cases even get reduced, because then it would be very important or safe to say that has the second wave that has struck Mumbai as well as Maharashtra badly, is it going back, or what we can say is, are we moving forward than the from the second wave that struck Mumbai? So it would be very important to see that what will be the cases coming in the next few days. But as of now, what we can say is that yes, this is the lowest number of cases that has been recorded in the last 3 weeks, which is good news if we talk about Mumbai specifically. However, the death ratio is almost similar to the last, which has been in the last 2 days. So it would be also important to see that what steps are being taken or is there a reduction in the number of people dying in Mumbai as well?
Thanks for that analysis. Sohit Mishra reporting from Mumbai. Meanwhile, Karnataka reported nearly 30,000 COVID-19 cases in the last 24 hours. That's the biggest single-day surge in the state. The state reported 208 deaths due to COVID in the same period. The positivity rate is 15.52% and the case fatality rate 0.7%. This is all, of course, according to government data. The state capital, Bangalore, also reported its biggest ever single-day COVID surge with over 17,000 new cases. The total active cases in the state are now 2.3 lakh. And a complete curfew is being imposed across Jammu and Kashmir from this evening to Monday in the wake of a surge in COVID cases. For the last 1 week, authorities have already imposed night curfew in all 20 districts. The good news in the region is that there's no shortage of oxygen or essential drugs in hospitals so far.
Dr. Ahangar, what is the situation now? In many parts of the country, hospitals are facing acute shortage of oxygen and patients are dying. And can you tell us your hospitals?
So far, we have been trying to manage the system. We have sufficient supplies of oxygen, the basic and fundamental molecule in the treatment of the COVID pandemic. And then we have all other essential supplies. So far, so good. But however, we can foresee the disaster is unfolding.
Okay.
The way things are happening at Delhi, our capital, or anywhere else, any other country, we need to be geared up and we need to be prepared for the things. We had to understand that the first line treatment is the availability of the oxygen.
So do you have enough oxygen plants available here?
We got 2 more units and we installed them, and today our oxygen demand for our patients today for the entire institution, including COVID management, is around 3.95 lakh liters per hour. Okay. We have the capacity to generate about 1.95 lakh liters per hour from our own concentrator plants. We get bulk oxygen cylinders from the private vendors from 2 gas agencies, JK Gas and Mia Gas. In addition to this, we have got 2 more oxygen concentrator plants which are in the process of installation. It's going to take us about 2 weeks more.
And just days after the central government announced that it's allowing the sale of COVID-19 vaccines in the open market, Bharat Biotech has now announced its price for Covaxin, and interestingly, it is going to be more expensive than Covishield at 1,200 rupees for the private sector. It's actually 100% more expensive than Covishield. And at 600 rupees for the states, that's going to be 50% more expensive than Covishield. Special report on what the present pandemic has meant for the transgendered community that's had no traditional source of income anymore, a community that was already marginalized and in deep distress.
Transgender rights activist Vidya Rajput and her team from the Chhattisgarh Mitwa Sankalp Samiti visiting the Oxfam office in Raipur. It was thanks to Vidya's effort and Oxfam's support that the transgender community in Raipur were taken care of during the toughest months of the pandemic.
लॉकडाउन में कम्युनिटी के साथ में बहुत सारी समस्याएं थी, लोगों का काम छूट गया था, फैमिली का सपोर्ट नहीं था और कम्युनिटी के पास में कोई भी ऐसा साधन नहीं था जिससे वो अपना पेट भर सकते थे।
हमारा ट्रीटमेंट बंद हो गया था, किसी का शादी ब्याह हुई थी, बधाई बस्ती बंद हो गई थी और हमारे ट्रांसजेंडर लोगों को मतलब पैसे की बहुत कमी थी, राशन की बहुत कमी थी और बहुत प्रकार की प्रॉब्लम्स आ रही थी, सबके पास काम धाम नहीं था, तो हम लोगों को बहुत दिक्कतें रही।
With traditional sources of income gone, an already marginalized transgender community existing on the fringes of society was in deep distress. Oxfam's ration distribution drive amongst members of the LGBTQI community in different parts of India, including Chhattisgarh, provided some hope and sustenance.
ऑक्सफैम ने प्रयास किया कि रायपुर और पूर्व के तृतीय लिंग के लोगों तक पहुँचे और जितना हो सके उन तक सूखा राशन और कुछ हेल्थ और हाइजीन का किट पहुंचाने का प्रयास करें। तो हमने रायपुर में करीबन 250 से 300 तृतीय लिंग समुदाय के लोगों तक ये सामग्री पहुंचाई और उतने ही दुर्ग में हमने पहुंचाया। ये करीबन 1 महीने का राशन था, चावल, दाल और अन्य सूखी चीज़ें।
While the coronavirus crisis is far from over in India, there is at least hope that inclusive efforts like these will ensure no Indian is left behind in a time of great need.